Eliakim Makanga, who will make brief points, one and something more on border, another one on technical training. Alafu, we will just have two people, that is Archbishop Patrick Lehanda and Archbishop Albert Obede on the religious sector. Alafu tutamalizia na mzee John Ball kupeana vote of thanks. In that order. Thank you, Clara.
Good afternoon. Dr. William Ruto, Honorable Musalia Mudavadi, Honorable Wetangula, all honorable members and invited guests, good afternoon. Okay, my name is Clara Sibiko. I'm here to present matters on public health. Public health is key worldwide, and mostly I'm going to talk about in Kenya. Public health, it includes disease prevention, kuzuia magonjwa. Public health also includes promotion, which we're supposed to do promotions in all communities and all areas, how to prevent diseases. And then public health also includes treatment. And all these key points, disease prevention, promotion, treatment, as public health officers and my bosses and the juniors, we are not able to deliver because the resources are few. We don't have the resources to cater for the common mwananchi. Public health office, it includes the community health volunteer, who is on the grassroots, the village elder. Sisi tunaenda mpaka kwa nyumba, tukiangalia ule mama mwenye lala kwa kitanda. We are able to notify which village a mother has, which village there's a bedridden patient, which village has this disease, and then we carry onward. But we're not able to deliver this because we don't have enough resources. So we are requesting Honorable William Ruto, when you go on that seat, of which I know you're going to go there, kindly look on that key, because we don't have resources for the public health. Mostly for the key things that I've said: disease prevention, promotion, health promotion, and treatment. Treatment, my colleague has talked about, mostly on the KEMSA part, the KEMSA Act. The KEMSA Act, they should, when you go there, you should also help us to get the key drugs. The KEMSA is not even able to provide enough Panadol, a simple Panadol. If you go to facilities right now, a simple Panadol is not there. And as you know, as KEMSA Act, you cannot purchase any drugs outside the KEMSA bracket. In addition to that, my colleague has also talked on UHC coverage and NHIF coverage. Most of the grassroots people, they are not able to access services the way my colleague said, because they cannot afford the registration money. And again, because most of the referral sites, they are very far from where the residents are residing from. For example, most of the community members, they come from either nearer to the health center or a dispensary. So you find this, mostly this elderly. This elderly cannot find an elderly person moving from, let's say, in Muhaya, is coming to Vihiga referral to get treatment, and he'll tell you, I'm just going back to the house to die because I don't have fare. I don't know how I'm going to reach to the referral. And then I think is accessibility. Sorry, we need to make sure that accessibility and referrals. Most of our mothers, they live at home, and we get maternal deaths because we don't have a good system of referral like ambulance. In Vihiga County, if I can tell, maybe you have 3 ambulances or 2. and we find a mother coming from the interior delivering at night. And most of the mothers deliver at night. We find this mother is going to deliver at home, and the mother complicates, and the child dies, and the mother dies. That's a maternal death. So we are requesting if you can get more ambulance in our county. And then again, the level 6 and level 5 referral, as my colleague said, we don't have in Vihiga County, and I'm just requesting to all counties we should have level 5 and 6 for better services. And then for a better economy and productivity nation, a good productive nation, and all those things, public health is key. We need to prevent from the grassroots kindly. And if you don't prevent from the grassroots, we are going to have so many patients at the hospitals, which the clinical officers and the other staff are not going to be able to manage. At the moment, the CHVs are doing treatment on the household. They have you have issued them the drugs for malaria, RDT for testing the malaria, but they don't have even equipment, even the simple gloves they don't have. And referring the patient to the hospital is also a problem. Lastly, I want to talk of enough drugs. I think I've talked of enough drugs. And another thing, Tena, is most of the health workers, I don't know if my colleague talked about, if you are not motivated, there's no way you can work better. Most of the health workers are stagnated in one job group. From the time they're employed, they're just working. They've not been promoted. Secondly, there are people who who are employed recently, whom their money is taking too long for them to be paid. They've been paid some money, but they've been being promised to be paid more money. But these workers, they have families. Kindly, Honorable, kindly I'm requesting you take us back to the national government when you get there. Because devolution is frustrating us. And when we are frustrated, the patients are also frustrated. So for quality services, for health, we need to go back to national government. And to add in that, I want to thank you for coming in Vihiga County and make a habit of coming to Vihiga County. Thank you.
Thank you very much, Clara.
As the two young men come, let Madam Joyce Mayor speak first. Alex